how do you socially distance in a refugee settlement of nearly 1 million people? The coronavirus has reached the overcrowded Rohingya refugee camps in southern Bangladesh, and it's a nightmare scenario for international aid agencies now racing to stem the spread of the virus.
There are serious concerns about potentially severe impact of the virus in a densely populated refugee settlement sheltering some 860,000 refugees.
At least 10 people have tested positive for COVID-19, prompting authorities to beef up preventive measures. Tents where infected people were living have been locked down, and teams have been activated for the treatment of patients, as well as tracing people they might have had contact with for testing and quarantine. Rohingya, one of the world's most persecuted communities, escaped a brutal military crackdown in 2017. More than 700,000 Rohingya Muslims were forced to flee Buddhist-majority Myanmar to neighbouring Bangladesh, where they sought refuge in squalid and cramped camps. They now live in these canvas and bamboo shack camps, each one barely 10 square meters, and many overcrowded with up to 12 residents. 34 camps have more than 40 times Bangladesh's average population density.
The Rohingya refugee camps are actually some of the densest on Earth, approximately 40,000 people per square kilometer. Now, just to give you an example, New York City, the densest city in all of the US, has around 10,000 people per square kilometer. So the camps are 4 times more dense than New York City. This means any attempts at social distancing or self-isolation will be extremely difficult. Add to that the sort of poor hygiene and sanitation in many parts of the camps, with access to clean water and hand washing facilities so scarce. So yes, we think the potential for a large outbreak is very real.
While people across the world are being told to keep 2 meters apart during the coronavirus pandemic, in Kutupalong refugee camp, that is the actual width of most parts. This makes social distancing virtually impossible. In Bangladesh, the coronavirus infections have overwhelmed the country's already weak healthcare system. On May 1st, the total number of positive cases were around 6,000, and in the span of 18 days, the number jumped to more than 23,000 with 349 deaths, and a peak in infections expected in the coming weeks. In early April, authorities imposed a complete lockdown on Cox's Bazar's district after a flare-up of COVID-19 cases in the country. All traffic in and out of the camps was restricted, forcing even aid organizations to slash their camp presence by 80%. Despite this, cases emerged in one of the camps. With a shortage of healthcare staff and services in these camps, aid workers are now warning of a looming humanitarian disaster.
Bangladesh as a whole is really going to struggle to cope with a full-blown outbreak. This is a country of 160 million people and only 2,000 ventilators. And in the camps themselves, there are no ventilators whatsoever.
Charity organization MSF International says that before COVID-19, most of the patients it treated exhibited respiratory tract symptoms such as shortness of breath, which increases their chances of catching the disease. Adding to the misery of Rohingya is also the internet ban imposed by the Bangladesh government during last September. Masks that have become a daily essential in much of the world during this pandemic are rarely seen, and sanitizers are unheard of. The camps are now hotspots of misinformation as access to reliable information and news about the disease is hampered, fueling a sense of panic and chaos among the refugee population. The arrival of COVID-19 cases in Rohingya camps also comes at a time when they are being inundated by monsoon flooding and cyclones. Experts anticipate that monsoons, along with the deteriorating sanitary conditions and poor health of refugees, will be the ideal breeding ground for the disease. Aid agencies are appealing for funds and international support to tackle this, and have also ramped up their response.
IOM is preparing 250 severe acute respiratory infection isolation and treatment center beds, which will come online very shortly. We have updated triage areas in the 35 primary care facilities we support, along with 3 isolation and treatment centers, and a 93-unit contact tracing quarantine center large enough to accommodate 465 people is nearing completion.
A projection by Johns Hopkins University researchers says the epidemic will spread slowly in these camps before rapidly cascading within a year as infections build. So in case of an outbreak, will the authorities be able to avert a catastrophe?